This is the Emergency Medical Minute, sponsored by Health One.
Hello, Emergency Medical Minute listeners. This is Nancy Larance, faculty in Biological Sciences at the University of Denver and pre-health advisor for the university. I want to tell you about an awesome event that we're hosting later this month. On November 21st to the 24th, clinicians, educators, policymakers, and community will gather at the University of Denver for the first Colorado Behavioral Health and Wellness Summit. The intersection of mental health and substance use continues to be a challenge in the state of Colorado, as you know. The University of Denver, the Mental Health Center of Denver, and Envisionio join forces to create the summit as we share a collective commitment to encourage neighbors, friends, family, and colleagues from all around Colorado to learn more about behavioral health issues and substance use disorder. At this summit, speakers and presenters will engage our community to break down silos statewide and to bridge gaps in communication and collaboration. The summit will provide various audiences with approaches to awareness and education, training and clinical practice, and policy, advocacy, and action. Participants are able to discover new tools and resources, discuss practical strategies for change, and connect with colleagues and experts. We hope this community collaboration will foster an increased focus on tackling these difficult issues. The event is free and open to the public, and we hope you all join. For more information, please visit our website at portfolio.du.edu/CO Health and Wellness Summit, or you can contact me at nancy.larenzon@du.edu.
Okay, so I'm going to talk about everyone's favorite topic for a medical minute, which is abstinence. Abstinence, yes, the very germane, very sexy topic of abstinence. But not abstinence that many of you might be thinking of, but abstinence from, guess what? Opiates and drugs. Yep. So yeah, I'm a broken record, I guess. So, abstinence and substance use disorders. I think a lot of us think that the treatment for substance use disorders is abstinence, right? Just don't stop drinking, stop doing cigarettes, stop doing heroin, and that's the way you're going to get into sobriety and get into recovery. And while that's actually very true for alcohol, where abstinence-based therapies are pretty well proven, although medication-assisted therapies with alcoholism too are better than abstinence-based therapies only, or with smoking, where there's evidence to say if you quit cold turkey, you have better success than if you try to slowly wean yourself off cigarettes. In heroin use and opioid use disorders, abstinence is a very stupid thing to advise your patients to do. And that's for several reasons. One is the relapse rate when patients try to go abstinent and white knuckle it is extremely high. At 1 month, around 90% of your patients is going to go back to using. The second thing is if you actually admit patients to detox centers where all they recommend is abstinence, you actually increase the person's mortality rate, the chance that they're going to die in the next few months. And why is that? Yep. Exactly. Sheila hit the nail on the head. Their tolerance when you have a period of abstinence that's maybe 1 week, 2 weeks, 3 weeks, a month starts really decreasing. And then when they have that moment of weakness and they go back and they use again, they'll use out their same dose, and their risk of overdose is extremely, extremely high at that point. So abstinence-based therapies are something that we in the medical community, when it comes to opioid use disorder, should not be recommending. And I actually generally dissuade patients when they come in and say, well, we're just going to try to take them to detox. I say, there's actually a much better way, and detox might actually be dangerous for your loved one. And that better way is buprenorphine, methadone, naltrexone. All of those have been proven to be much, much better for patients with opioid use disorders. So that's another hit. There's one really significant study that was done in the Lancet, I think in the early 2000s, 2003, 2004, where they took around 25 patients, and it was I think it was in Norway or Finland, and they randomized them, these are IV heroin abusers, to either abstinence or to get buprenorphine. After 1 year, they kind of check back in and see how they did. For the patients who went to detox and then abstinence, all of them had relapsed by 90 days. So 100% relapse rate, 20% of them were dead. For the patients who you actually put in buprenorphine treatment, 75% were no longer using drugs, 75% were still getting treatment, and 0 had died. So you're talking a really big change in morbidity and mortality. And what you recommend to patients and their families when they're here seeking help for that type of care really matters. So abstinence is bad when it comes to treatment of opioid use disorder. Thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.